Welcome back for another deep dive. This time we're going to be taking a look at OCD, but through a lens you might not be familiar with.
Yeah, this is going to be pretty interesting.
We've got this paper titled Revisiting Obsessive Compulsive Disorder from a Transpersonal Perspective. And honestly, it's really challenging the typical ways we think about this condition.
It really encourages us to think differently about the experience. You know,
Yeah,
it's not just about these surface level symptoms.
right.
There might be something much deeper going on.
It really makes you think because we know what millions of people struggle with OCD.
Yeah.
You've got the intrusive thoughts, the obsessions, the compulsions, and it can really just take over your life. And what's even more heartbreaking is that a lot of people wait years before they actually reach out for help,
Absolutely.
you know?
And that delay just highlights how crucial early identification and intervention is.
Oh, yeah,
The sooner we can understand what's happening, the better chance we have of getting people the support they need.
exactly.
But that begs the question, what if those OCD symptoms are actually signs of a spiritual awakening that's just gotten, like, way too intense to handle?
Yeah.
And that's what we're going to be exploring in this paper, and it's fascinating stuff.
Okay, so we're going beyond just like the genetics and the brain chemistry explanations of OCD.
Yeah.
We're talking about transpersonal psychology now.
Mm-hmm.
I'll admit, this sounds a little out there to me. Can you break it down a
Oh,
little bit? Like
yeah.
for those of us who, haven't really gone down this path before.
Well, transpersonal psychology is all about experiences that go beyond our usual sense of self. It looks at spiritual development and those moments where we feel connected to something much, much bigger than us. And sometimes that process of expanding our consciousness can get really overwhelming. And that's where we see what's called a spiritual emergency.
Okay.
So you're kind of seeing where this is going.
Yeah, are you suggesting that what we diagnose as OCD in
Mhm.
some cases might actually be a form of spiritual emergency?
Exactly. Think of it like, imagine a spiritual awakening is a really intense growth spurt, but for your consciousness.
I like that.
And that can be really unsettling, especially if you're not expecting it, right? You're not
Ah.
ready for it.
So someone could be having these intense OCD symptoms, but what's really happening is they're undergoing like this profound inner shift.
Precisely.
I mean, that's a pretty radical way to think about
It
it.
is.
It is.
But think about how spiritual transformations have been described all throughout history. They often involve these really sudden and seemingly irrational fears,
Yeah.
obsessions with violence and death.
Mhm.
All those darker aspects of ourselves are coming up to be confronted as we move towards greater understanding.
I mean, it does make sense when you put it that way. It's like what we call OCD could actually be part of a similar process that we've seen in other people.
Mm-hmm. Yeah.
They're wrestling with this inner turmoil on their way to, like you said, a deeper sense of self.
Yeah.
But how do we explain then why people have these specific obsessions?
Right.
Like, why are some people terrified of germs and then others are worried about harming loved ones? Like what explains that?
Well, this is where Jung's concept of the collective unconscious comes into play. So imagine this vast shared pool of, like, memories, instincts, and universal patterns of thought and behavior that are passed down through generations
Okay.
from our ancestors.
So like instead of those anxieties and fears being purely personal, they might actually be tapping into something way older, something primal.
Exactly. Let's say someone's going through a really big life change. Let's use the example of having a baby, right? This can trigger that archetype of ritual sacrifice,
Right.
that deep-seated primal fear in the collective unconscious, leading to intrusive thoughts about harming the child.
Yeah.
And that's not about personal flaws. It's about those deep universal anxieties bubbling up to the surface.
It's giving me chills just thinking about it. So it's like those who experience these really intense OCD symptoms
Yeah.
are somehow more sensitive to these like primal energies in all of us.
It's a very real possibility.
Wow.
And, it makes you wonder about those creative geniuses throughout history who exhibited OCD-like symptoms. Were they just tapping into that collective unconscious?
Yeah.
And that fueled their brilliance, but also, brought them face to face with their deepest fears.
Like John Nash,
Yeah.
the mathematician.
Exactly.
Yeah.
He had such a hard time separating his really incredible mathematical insights from his delusions.
Right.
And that really blurs the lines between genius and what we might call mental illness.
Yeah. It really does. We've gone from brain chemistry to spiritual emergencies to the collective unconscious all in like, what, 20 minutes?
Yeah, I know. It's a lot.
I'm having to rethink everything I thought I knew about OCD.
Well, that's the beauty of looking at things from different perspectives.
Yeah.
It opens up a whole new world of understanding.
It really does.
And what I find really intriguing is this idea that OCD, with all its challenges, might actually be a pathway to personal transformation.
Hold on. A
Yeah.
pathway to transformation. Okay. You're going to have to explain that one to me.
Sure, so think about it. OCD forces you to confront your thoughts in a way most of us never have to.
Right.
Right. You can't ignore them. You can't escape them. You're constantly having to wrestle with these anxieties and these doubts.
Yeah.
It's almost like this crash course in what Buddhists call non-attachment.
Oh, yeah. Non-attachment, right? Remind me what that is again?
Yeah, so non-attachment is about learning to just observe your thoughts without judgment, recognizing that they're not truth. They're just mental events.
Right.
And that sounds a lot like what therapists try to teach people with OCD, right?
Yeah.
Acknowledge the intrusive thought, but don't get swept away by it.
And that's like mindfulness, too.
Exactly.
That's really popular now.
Yeah, and all the studies show it can be super helpful in managing anxiety.
Yeah.
So, those with OCD might actually be getting pushed towards a more profound understanding of the nature of thought.
Interesting.
And, that can lead to greater peace and freedom.
So instead of just saying OCD is a disorder, we could look at it as a potential sign of a deeper process that's unfolding.
Exactly. It's a totally different way of looking at it.
It's like those struggles, they're actually opportunities for growth and insight.
It's a really powerful shift in perspective.
It is.
What if, instead of labeling someone as sick, we acknowledge they might be on a difficult but ultimately transformative journey towards wholeness?
That's beautiful. It makes
Yeah.
you realize there's so much more to OCD than we initially thought. It's not just about managing symptoms, but it's about the potential for growth and healing that those symptoms might actually represent.
Exactly.
I'm curious, though, about the practical side of all this. How does this transpersonal perspective actually help people who are struggling?
That's a great question. And the paper does offer some insights on how we can use this understanding in counseling.
Okay, so tell me about that.
Well, for starters, the paper really emphasizes early intervention. If you're having these intrusive thoughts, don't keep it to yourself. Reach out. Talk to a mental health professional.
Yeah.
Don't wait years like so many people do.
Okay, that makes sense. Yeah, the sooner you address these challenges, the better. But what about the actual therapy approach? I mean, would that be different?
So while traditional treatments like therapy and medication are still incredibly important, this transpersonal lens encourages us to consider a more holistic approach. It's about addressing the whole person, body, mind, and spirit.
Gotcha. So it's not about replacing those traditional methods.
Right.
It's about adding to them.
Exactly. It's about integrating different tools and techniques. For example, the paper talks about the value of grounding activities.
Grounding activities, what are those?
Well, think of simple physical things like gardening or working with your hands. Anything that brings your attention back to your body and the present moment. These can be incredibly helpful for countering that mental turmoil that so often comes with OCD.
Okay, so like redirecting that anxious energy into something tangible and productive.
Right.
That actually connects back to what we were talking about with non-attachment. A lot of spiritual traditions, they emphasize the importance of being present in the body, of not getting lost in your thoughts. So maybe those grounding activities are a way to kind of put those principles into practice.
That's a great point. It's about finding ways to feel grounded and present. And another powerful tool for that is exercise, especially aerobic activity, which can really help shake off those obsessive thoughts.
Oh, I can definitely vouch for that. There's nothing like a good run to clear your head.
Absolutely.
Totally.
And then there's always those classic relaxation techniques, hot baths, massage, anything that can calm the body and quiet the mind.
I'm a huge believer in a long hot bath. It's like a reset button for your nervous system.
It really is. And even something as simple as diet can have a huge impact on our mental and emotional well-being. Nourishing your body with healthy foods supports mental stability.
Yeah, it's like that saying, you are what you eat, right? It's not just about physical health, but feeding your mind and spirit as well.
Exactly. And speaking of feeding your mind, here's another strategy that might surprise you. A media detox.
Okay.
Limiting your exposure to stressful news and violent entertainment can be incredibly helpful, especially if you're already dealing with a lot of internal anxiety.
That makes a lot of sense, right?
Yeah.
If you're already being bombarded by anxiety from within, why add fuel to the fire?
Exactly.
Create that peaceful space for yourself.
Precisely. And it's important to remember that all these strategies are meant to be complementary, right? They work best when used alongside traditional therapy and medication, not as replacements.
Right. So it's this multifaceted approach.
Yeah.
You're drawing on all these different tools and techniques to support healing and growth. And when you think about it that way, it really reframes this whole idea of what it means to have OCD. It's not just managing symptoms. We're talking about a potential journey of transformation.
Right. And that journey may involve facing some pretty challenging parts of ourselves.
Right.
But remember what we were talking about earlier with the collective unconscious.
Yeah.
Maybe those anxieties, those fears, those intrusive thoughts, they're actually opportunities for growth and integration.
It's like we're being called to confront those darker parts of ourselves.
Yeah.
Not to get rid of them, but to really understand them, to make them part of our wholeness.
Exactly. It's about recognizing that even those things we might see as broken or flawed can actually be sources of strength and wisdom.
Yeah.
It's about embracing the full spectrum of human experience.
It's like that Rumi quote, "The wound is the place where the light enters you."
Yeah, I love that one.
Maybe those of us who struggle with OCD are being invited to kind of explore those wounded places,
Yeah,
to let the light in, to emerge stronger and more whole.
it's beautiful.
It is.
It really speaks to the potential for healing and transformation that this perspective offers.
Yeah.
It's not about labeling someone as sick or disordered. It's about acknowledging they might be on a difficult, but ultimately really enriching path towards wholeness.
I gotta say, this whole conversation has been a real eye-opener. It's making me rethink everything I thought I knew about OCD.
Well, I'm glad to hear that. Ultimately, the goal is to create a more compassionate and nuanced understanding of mental health.
Absolutely. And speaking of understanding, I feel like we've covered a lot of ground.
Yeah, you have.
We explored the traditional explanations for OCD. We dived deep into this transpersonal perspective. We even touched on some practical strategies for coping and healing. But if there was just one key takeaway you wanted our listeners to walk away with, what would it be?
I think the most important thing to remember is that OCD is complex. There is no one-size-fits-all answer. This transpersonal perspective offers a really valuable alternative to the more medical or psychological models. But it's not about saying one is right and the other is wrong.
Right.
It's about expanding our understanding and recognizing there are many different paths to healing.
It's like we're adding another piece to the puzzle,
Exactly.
another way of viewing this human experience.
Exactly.
So as we wrap up this part of our conversation, what's one thought-provoking question you'd like to leave our listeners with?
I think I would ask them to consider this. Could there be a connection between how intense our internal struggles are and the potential for growth and transformation that they hold?
Mm.
What can we learn from those who have faced those similar challenges and come out on the other side with more wisdom and insight? It's something worth thinking about.
Okay, so tell me about that.
Well, for starters,